I want to begin with a moment. It was a Thursday morning in the free clinic, the kind of morning where the waiting room feels like a small community. Kids coloring, volunteers chatting with patients, that steady hum of human beings simply being together. A woman came in. Let's call her Maria. She carried herself like someone who wanted to be small. She had delayed care for months. No health insurance, 2 jobs, 3 kids, the fear that she would be turned away. She told me later that she almost didn't walk in the door. But the moment she sat down, our longtime volunteer, an older woman, Monica, who has been greeting patients for years, looked her in the eyes and said, "We're glad you're here." And Maria started to cry, not because of the pain, but because of relief. Later, after she saw her nurse, her doctor, and the pharmacist, she said something I will never forget. "This is the first place where I felt like a person and not a problem." That sentence landed in me like a bell, and it changed the way I see healthcare, not as a system of services, but as a community of relationships. The problem is we have a system brilliant at everything except being human. We live in a country with some of the most advanced medical technology in the world: robotic surgery, precision medicine, AI diagnostics. Pick your headline. We're brilliant at innovation, but we struggle at something much bigger, much simpler. We struggle with being human. People aren't just falling through the cracks in the system, these cracks aren't accidental, they are baked in. Millions delay healthcare because of cost or fear. Clinician burnout is under the weight of volume based expectations. Patients tell their story 5 times, but never feel heard once. I've spent almost 3 decades in the public health sector, mostly urban areas, developing interventions for big problems, trying to put band aids on the health needs of the people I'm trying to serve. But there was always this tension. The closer I got to the problems, the more complicated it became and the more overwhelming to solve. And then, almost quietly, almost humbly, I got transplanted to the most unexpected place in rural Wisconsin. And I saw another model emerging in my own backyard. When people hear the word free and charitable clinic, I'll tell you, it is not what you think it is. When you hear free clinic, people imagine a safety net, a temporary solution, a church basement, the last resort. But as a leader of Open Arms Free Clinic for the past decade in Walworth County, Wisconsin, that is not what we created, and that is not what I see. What I see is a living prototype, a blueprint for the future that already exists, quietly, consistently, powerfully. Open Arms Free Clinic is among the 1,400 free and charitable clinics and pharmacies in the U.S., a massive, under-recognized ecosystem of care. Collectively, the members of the National Free and Charitable Clinics serve 1.7 million people every year and provide 6 million patient visits, more than many regional hospital systems. In these clinics, health isn't delivered to people, it is created with people. Retired physicians, interpreters, neighbors, nurses, college students, local businesses, everyone becomes the ecosystem of care. And through all of this, something remarkable happens. Patients don't just receive care, they experience belonging. And belonging, as it turns out, is one of the most effective public health interventions we have. There are 5 principles of community powered healthcare that make this model transformative, not only for the uninsured, but for the future of healthcare as a whole. The first principle is trust is a clinical intervention. Trust is medicine. In community clinics, trust isn't a byproduct, it is built intentionally. When a patient sees the same front desk volunteer every month, when their interpreter comes from their cultural community, when they don't have to retell their trauma to a new person every visit, their blood pressure drops before the provider even walks in the room. Trust shortens treatment time. Trust improves adherence. Trust reduces emergency visits. Trust makes prevention possible. And trust is created by people, neighbors, who choose to show up. The second principle is that the community is the workforce. One of the most radical features of free and charitable clinics is that they blur the line between clinician and neighbors. In my rural town, I can go to the grocery store and say hi to a patient, a volunteer, and a donor in the same visit. We're all neighbors. We're all in this community. Nationally, free and charitable clinics operate with a total workforce of over 200,000 people, and 92% of them are volunteers. That includes 76,000 medical volunteers, 113,000 non medical volunteers, and 43,000 student volunteers. Clinicians volunteer because they want to practice the kind of medicine they were called for. I have a retired physician who says, I finally get to practice the medicine I always dreamed of. Neighbors volunteer because they want their communities to thrive. Student volunteers because they want to shadow a compassionate healthcare worker as they're preparing for their own professional healthcare journey. The hybrid workforce of professional and volunteer, it's not just a budget trick. It's a design innovation. It restores purpose for those who give and dignity for those who receive. And all of these people together create an ecosystem of care that no single organization can replicate alone. It turns a healthcare encounter into a community act of care. The third principle is care is a relationship, not a transaction. If you really want to understand community powered healthcare, sit in on an appointment. You'll notice something immediately. There's time. There's time to talk, time to unravel the story, time to listen to the thing that's not being said. One of our providers once told me, when I slow down enough to hear someone's whole life, the treatment plan becomes obvious. Patients aren't numbers, visits aren't units, health is not measured in lab values. In our clinics, listening is part of the treatment plan. The fourth principle is that the whole person and the whole community care. Free clinics don't treat symptoms, they treat systems. The patient never comes alone. Their family comes with them, their job, their stress, their housing situation, their cultural identity, their story. Community powered clinics respond holistically. Medical care is mental health, medical care is food access, transportation support, language support, health education, connection, and dignity. And because we see patterns across hundreds of patients, we recognize community needs early and respond together. This isn't charity, this is community infrastructure. The fifth principle is affordability through humanity, not volume. There's a myth that high quality care must be expensive. But in community powered models, costs drop for a simple reason. People get what they need before the problems escalate. The volunteer interpreter who builds trust prevents crisis. The relationship based visit catches conditions early. And a community network prevents an isolation, which is one of the biggest predictors of chronic disease. Prevention isn't just what happens in the exam room. Prevention is what happens when a community is organized around caring for one another. So, what do free clinics teach us about the healthcare system we need? Well, the bold truth is this: if we were to design a healthcare system from scratch today, with everything we know about trust, cost, connection, prevention, the blueprint would look like a free and charitable clinic. These clinics teach us that local solutions scale best horizontally, community to community, not top down. The hybrid workforce increases capacity without sacrificing quality. Listening saves money. Cultural humility is as important as clinical accuracy. Community is not an accessory to healthcare, it is healthcare. There are helpers and healers in every community. And as we look toward the future, integrated, equitable, sustainable healthcare, this quiet model offers an answer. Human centered care is not a luxury, it is a system design choice. So, in closing, everyone has a role in community healthcare. Let me return to Maria. Months after her first visit, she came back, not as a patient, though, but as a volunteer. She wanted to give back to somebody else the experience that she had received. The thing about community powered healthcare is everyone who is touched by it eventually becomes part of it. It blurs the line between giver and receiver, between patient and partner, between service and belonging. And I believe that is the future of healthcare. Not a system built on transactions, but on relationships. Not driven only by technology, but by humanity. Not a place we go when we're sick, but a community we build when we are well. When a community comes together to care for its own, we don't just heal individual people, we reshape the future of healthcare. Thank you.